Well, hey, friends, welcome to the podcast. I have a super special guest for you today. I want you to listen to somebody that's very near and dear to my heart. She's actually my number two daughter, but as you'll hear in the interview, she thinks she's number one. But we'll leave that conversation for another day. We are going to be talking about mammography and thermography. And my daughter, Ashley, runs a wellness clinic in Northern California. She's been on the podcast before, and she is a licensed thermography tech. So she works with women all the time doing breast and other, body areas using thermography. And so she was the perfect person to come on and talk to us about why we may want to consider thermography, which for those of you, you already know this, but we are going to get into also why the pushback from the medical side against thermography in lieu of mammography. So we're going to talk about some of the risks of mammography, and then we are going to really lean into thermography. And as you'll hear, there were some surprising little nuggets that came out of this conversation. So without further ado, here's my interview with my daughter, Ashley Houchin. Well, hi, Ashley. Thanks for joining me on the podcast. We've chatted before, but I'm super glad that you're here.
Thank you. I'm glad to be here. Thanks for
Yes,
having.
you're welcome. So, for all of you that don't know, or maybe you missed our prior interview, Ashley is actually my number two child. And so I'm just super proud of her. For those of you that are watching,
Number
you
one.
saw the little finger she put up. It was not the middle finger, it was the number one finger, which means she's competing with her sister, older sister. So, okay, Ash, you can be number one for today. It's fine.
Thank you.
You're welcome. Okay, we are going to talk today about mammography and thermography as it relates to having and offering this in your practice or recommending it for your patients. So, just so you know, Ashley runs a wellness clinic in Northern California just for women, and she also is certified to do thermography. So she does a lot of thermography, which means she sees a lot of breast images, and she's got some experience that I think you're going to really want to know about. But before Ashley dives in, I just want to give you a few tidbits of info that you may or may not know about mammography. So we know that mammography is big business. Like, there's no question about that. It is big business. These machines are expensive. The campaigns around breast screening, cancer screening, all of that are big, big, big in the revenue generating department of, modern medicine, so to speak. So it is the gold standard. Women are going to go to get their mammography, get their mammogram done every year. But we know that when you compress that breast tissue, you are putting the breast tissue under high amounts of stress, and then they radiate the crap out of it with these x-rays. And what happens is we end up with high numbers of misdiagnosis. Ashley, in your clinic, how many women would you say that you've seen or you would estimate would come to you and they have had maybe a misdiagnosis, whether it's a past misdiagnosis or even a current one? What would you say that percentage is? What do you think?
For me, probably 1 in 5,
One
maybe,
in five.
that I've seen.
Yeah.
And a lot of
Like,
the women that I see, honestly, aren't doing much mammography or ultrasound. So I see, less than probably there are.
okay, but they've had a misdiagnosis at some point in the past.
Mhm. Yeah.
Yeah. So then how does that affect them? Like, what's the conversation that you hear from them? Because you're dealing with breast health, right? What is
Mhm.
that conversation? How is that for them when they've been misdiagnosed? What kinds of conversations do you have with
Well, it's honestly a lot of trauma for them, a lot of fear because they've been diagnosed once, even though they turned out to be a misdiagnosis, but now it's kind of like in their head, they're thinking about
them?
it.
Yeah.
And yeah, they're they're traumatized, to be quite, honest, and it's sad and
Yeah.
awful to watch.
The Greek word, and I didn't know this, but the Greek word for trauma refers to the creation of a physical wound. I did not know that. So when we have a trauma on an emotional level, it's akin to having a physical wound where there's actually a
Mhm,
wound. It's a wound of the soul, right?
mhm,
Well, there was a study that I found, and I'm going to read this. It said women that were misdiagnosed had significant mental, physical, and emotional consequences even 6 months
mhm,
after they were cleared of that diagnosis. And there were 12 things that this study listed. One, here they are: a sense of dejection, anxiety, negative impact on behavior, negative impact on sleep, a degree of accelerated breast self examination, like, oh my gosh, what am I
Checking all the
missing?
time.
All the time, exactly,
Mm,
which is going to irritate the breast tissue.
yep.
Negative impact on sexuality, negative feelings of attractiveness, inability to keep their mind off of things. In other words, they're worrying about it.
Mhm.
Worries about breast cancer, of course, lack of sense of inner calm, change in their social network, and existential values began to shift because of mortality. You start
Mhm.
thinking about, well, what if I get breast cancer? What if I die? And who's going
Mhm.
to take care of my kids? And what about my will? And what about my husband? And will he remarry? And, you can see that spiral effect. And it's all because it's this big business. Then we're
Yeah.
subjecting these women to these mammograms and they don't need that. They recently said that after 10 years of mammography screening, the risk of false positives is up to 63%. That's just heartbreaking.
Mhm.
So millions of women get misdiagnosed every year. So these false positives, then they have to go in for more radiographic imaging, ultrasounds, doctor's appointment, maybe, invasive needle biopsies, and then you're waiting for the results, and then there's anxiety there. And that
Yeah.
doesn't even include the number of people that have been, we'll say, misdiagnosed from the biopsy.
Yeah.
Where misdiagnosis can happen just because of a bad mammography, where they're saying, oh, there's something there when there isn't anything, but also just even misdiagnosed with just basic what they would want to treat with chemotherapy that doesn't even need to be treated, and it can, like DCIS, right? It can go
Mhm.
away all on its
Right.
own.
Yep.
So when you approach someone who comes to you, you're seeing someone in your clinic, how do you start the conversation about the risks or dangers of mammography and what the alternative is with thermography? Because thermography is kind of the big, bad, dirty word. Medicine's going to say,
Yeah.
oh, it doesn't mean anything and it's not reliable and it's not
Yep.
accurate and you need to have a mammography. Well, of course they will, because that's their big business.
Definitely.
So, how do
Mhm.
you bridge that conversation with them? Well, how do you start that?
Well, it's tricky because since I do thermography, there's a lot of things I'm not allowed to legally say to
Okay,
people.
but on this podcast, we can say them all.
Okay. I can't say that it's a replacement for mammography. And quite frankly, there is an error rate with thermography. I'm going to be transparent. There's about 10% error rate because 10% of all cancers don't carry a thermal signal. So if you don't have a thermal signal picking up, there's nothing for the camera to see if
Pick
there's
up.
no
Yeah.
signal.
That's good to know.
On the other hand, ultrasound is also a great option for people if they want to have a structural screening because thermography is looking at the physiology. And I explain this to people all the time. Thermography is looking at physiological happenings of the breast.
Yeah.
Where's the blood flow? What's happening? How is it moving? Is it in a funny spot? Is it asymmetrical across the breast? Do we have estrogen issues in the breast tissue? So it's looking at what's the body doing? Whereas mammography and ultrasound are going to look for structure. They're looking for like an item in the breast
A
and
mass,
a
some
mass.
substance.
If a woman has like fibrocystic tissue, there's going to be tons of little cysts in her breasts, and mammograms and ultrasound can't actually see through that. There's a 60 to 80% error rate when you have thick, dense tissue. So,
For
I
mammography or thermography?
for mammography and ultrasound, both.
Mammography and ultrasound. Okay. If you have
Yeah.
thick, dense fibrocystic breasts, and for, practitioners, you need to be asking that question of
Yeah.
your female patients. What is the texture of the breast tissue? Are they soft and malleable, or are they thick and fibrous?
Yeah. And now, thankfully, even with mammography, which no one really loves mammography here, let's be real.
Yeah.
But they are telling women there's a high error rate when you have dense tissue. It's now legally required for them to disclose how dense a woman's breasts are, and they'll give them a rating. So if they have a really
Oh,
dense breast tissue, and completely ineffective for them up to, a certain degree. Oh, sorry. Back to your original question. I always
no,
tell
this is all
tell my
good. You
patients,
go. Take your rabbit trails. We're good.
I always say it's really good to have more than one option. Like personally, I get thermograms, and then if I need an additional screening option, I'll opt for an ultrasound because the radiation isn't happening, the boob squish isn't happening. It's a lot more comfortable. I don't know if you've ever had an ultrasound, but it's much better than a mammogram. And then you get to see both sides. You get to see the physiological side and you get to see the structural side, and they don't cross over each other. Like, they're looking at such different things. It's like compares apples to oranges
Yeah, yeah,
and how you're looking at the breast. So
yeah.
I always tell people, I always recommend they have more than one screening option. For me and most of the people that I see, they just aren't interested in mammograms because of the radiation, because of the squish, the risk of bursting a capsule, damaging a lymph node. There's just too many
Yeah,
risks.
yeah, besides the risk, I mean, obviously there's the inherent risk of the radiation, right? The increased damage, frank
Yeah.
damage to the cells of the breast tissue because we've compressed them, put them under stress, and now we're going to radiate the heck out of them. So
Yep.
you mentioned like, lymphatic damage, bursting a capsule. What else do you know that could happen as a result of a traditional mammogram?
Well, those 2 things, plus, like you said, the radiation, those are the biggest things that we see. And I can't tell you how many times I see people that are like, I've been getting mammograms for 10 years and they finally found something. I'm like, well, yeah, you've
Of course, because
radiated
you
your breasts to death and
exactly. Yeah.
squished them and probably burst something. Like, that's a lot of pressure squeezing those breasts.
Yeah.
And especially if the breasts are smaller, it could be so damaging, especially to the lymph vessels and the lymph nodes because there's nowhere to go. So they have small
Right.
breasts.
Right. Right. I had one thermogram probably in my 30s, and it was so painful. It was really, really uncomfortable. I did not like it. I thought, I'm never doing this again. And so I didn't. And then I found thermography and have been doing that for quite some time. And then you became thermography tech. And so now, obviously, I have thermograms done. But let's talk a little bit about ultrasound. So, are you talking about a straight ultrasound, or is there a certain type of ultrasound that pairs well with a thermogram, providing that the woman doesn't have fibrous breast tissue?
Just a 3D ultrasound, just the handheld thing. It's a
Yeah.
big machine that goes right over the top of your breast and it kind of rolls over it. And you can image one or both breasts. Depends on the doctor that you're seeing, what they'll want to do. Some doctors will even do an ultrasound without a referral. I know we have one here in town that you can just make an appointment for an ultrasound, no questions asked. They'll give you one. The chances of insurance covering it are slim to none because they
Yeah.
want to see a mammogram before they'll do an ultrasound.
Right. Right.
So clients just have to know that they'll have to pay for it. But yeah, it's a good option.
So, like if you do a thermogram on someone, how often do you refer them out for an additional 3D ultrasound?
As a tech, I don't do any kind of like assessment of the images myself. So I'll usually go with whatever the doctor says. So I'll do the images, I send the images off. The doctor that I send them to writes up a report, sends it back to me. And then as soon as I get it back, I'll send it to the patient. And within the report, he'll usually say, I recommend you follow up with your doctor for additional screening, or you need to go right away to get another type of screening, or just come back and get a thermogram in a year because everything looks great. So
So,
it just depends on him.
okay, so explain for someone who doesn't know. I think everybody probably knows, but just as a baseline, like what exactly is thermography looking at and what do you see when you do a thermographic scan? We obviously know that it's picking up heat, right?
Hmm.
Heat that comes off, but we think, how can a camera detect heat? So, can you kind
Hmm.
of walk us through the process and what it looks like when you see a thermogram, what it's picking up?
Okay, so the thermal camera, the one that I have is a medical thermal imaging camera. There's a lot of different thermal imaging cameras you can get. A lot of industrial occupations use them, technical occupations use them. But for medical use, there's only a few that are FDA approved on the market that you can buy for medical screening. And what it does is it basically just looks at the heat reflecting off of your body and it picks that up to the 5/100th of a degree down within the breast tissue. So it's
Wow.
very, very minimal changes in temperature that it can pick up. And that radiation that's coming off of your body is what it shows up on the screen. Blood vessels, different scales of heat, depending on the view we want, we can look at it in color or black and white or reverse, or there's a lot of different ways that we can look at the breast, but it shows me a scale. And then there's a hot scale and a cool scale. And then all the temperatures in between will show up in different colors or levels of gray that you'll see depending on the image and the color.
And so I always got confused, and I've told you this before, but I'm always like, Okay, what's a better color? I like all the bright colors. Like, I
They're
want the
pretty.
colorful. I want to see
Yeah.
all the color on there, but the colors are the parts that are cooler, and the
Well,
darker the color is warmer.
it depends. So typically, like when I'm taking the image, it'll show up in black and white, and the dark is cool. The white is hot.
Okay.
So you
Dark
want it to
cool.
be nice and dark. Ideally, every woman has really nice, dark black breasts and black nipples. That's what you want to see. You don't ever want to see white nipples or a lot of white around the nipple area ever. It's not good.
And then what about, like, there's a gradient of color, like there's yellow and there's red and is that
Mm.
just the degree of temperature? Is that what that
Yeah.
is?
So if we change it to a colored image after we've taken the image, we can turn it into color. And then the scale, it's kind of different for every tech, the color scale they want to see, because to the doctor, it actually doesn't matter. But it's a cool visual for the patient to be able to see. People really love to look at the colored images. So for me, like my cool color is still black, but then it goes to brown and blue, purple, green, and then up all the way to white, which would be hot, hot, and then red would be just below that. So it's a quite a scale.
So if you do a thermogram and you see a lot of white showing up or those, you know, hotter
Red.
colors, right?
Mhm.
Does that make you nervous?
Sometimes,
Mm.
yeah, if it's symmetrical across the breast and there's a pattern that's kind of mirrors both sides, it's typically nothing to worry about. Might just be warm breast tissue. They might have needed more time to acclimate to the room. They have to sit for 10 minutes with no clothes on to get their skin at the same temperature as the room. So they might have needed more time. Typically, when the worry comes is when there's one side that's
Mm,
red, orange, yellow, and the other side is like purple and blue.
right,
You
right.
don't really want to see that.
Yeah. Or on the black and white, you've got a lot of dark on one breast, and then it's giving you
White.
grays and shades of
Mhm,
lighter color on the other breast. So the asymmetrical findings. So when the report comes back from the
mm,
doctor, I know there's a grading scale. So talk us
mhm.
through what that grading scale looks like.
The grades between a TH1 and a TH5. TH1 is what I was talking about, like nice dark. Everything's dark and almost black, dark gray. Everybody wants those perfect dark boobs. And then TH2, there might be a little bit of activity. There's probably some estrogen floating around, like up in the top here. And then 95% of women fall into a three category. So most women that I see are a three. It's considered normal, I think, because it's more common now,
Hmm.
but it's not considered, oh, it's not okay. It still comes up as questionable or even abnormal on the report. So you don't really want to be a three, but 95% of women are. And that's
Are
just,
as a side note, do you think that's because of all of the exposure to, like, the xenoestrogens, all the things that
Mhm.
we are exposed to because the breast tissue is rich in estrogen receptors?
Yeah.
So do you think that that's part of that? I would think it would be.
Yeah, because there's a direct correlation between estrogen dominance in the breast tissue and breast cancer. It's the number one risk factor. And your breasts can have up to 50 times more estrogen in them than the rest of your body. So someone can go get a hormone test and be like, my estrogen's fine. And I'll look at their breasts in their images and I'm like, no, your estrogen is like through the roof because I can see it. It opens
Wow.
up all those blood vessels and feeds whatever's in there. So yeah, no, I think it has a lot to do with our environment, what we're breathing, our food, the plastics that we're eating out of, cooking
Yeah.
with.
Okay. So then TH3 is normal, not normal, but
Mhm,
common. And then
mhm.
TH4.
TH4 is usually like you need to go get screening now. Like call your doctor today, go get screening. And TH5 is like run, run to the doctor.
Do not walk, do not pass
No,
go, do not collect $200. Just
nope.
go.
Well, since I've been doing this, I might have had maybe 3 or 4 TH5s in a year and a half.
Mm.
In the last 3 weeks, I've had 4 more, and I've not seen that many in a cluster, like that, where it seems to be happening more and more, and I think it's things that we can control, but some of it we can't.
Yeah.
Um,
It's really true. And to, your conversation about environmental exposures, we don't know what's in food. And a lot of women don't realize that body care products and skincare products and, the
air
meat that they're
fresheners.
eating and, yeah, air fresheners and laundry soap and all that stuff is
Mm,
all going to contribute. And those are things that we have to some degree, some control over.
Mm.
What we don't have control over is, if it's
Air.
chemtrails or pesticide, right? The stuff that we're breathing, things that
Yeah.
are in the water because we can't not breathe and we can't not drink. Like, at some point, we're not going to be able to control every little thing.
Mhm.
But if you get somebody that's got a TH3, they're in that 95%. Like,
Mhm.
what are some of the recommendations that you make for them?
I always tell people to do breast massage daily.
Describe how does that work? Is that just like rub, rub, rub? Like there's
No.
got to be a pattern
So
to it.
there is a method. It takes a minute. So I'm happy to show everyone, but it
Well,
takes
describe it because most people are going to be listening, not watching.
okay.
The watching is on
Um
YouTube. So
okay.
here, describe.
So you would open up the lymph nodes in the neck, in the abdomen, and in the under the armpit on both sides.
Mm.
And then you move the fluid essentially from the breast to the armpit, out the neck, and then back down into the stomach because the
So
stomach is
this is
ultimately
just
where you want it all.
fingers on skin in the shower.
Yeah. Ideally, you want the skin to stretch. You want to have enough
Oh,
grip. So in the shower is actually not ideal because wet isn't
oh,
gonna
oh,
isn't gonna
allow you to stretch. Yeah, yeah.
yeah, you kind of want to have a little bit of friction or grip, I guess,
Pull on
on
the
the
skin.
skin. Yep,
Yeah.
until you reach that end feel where it won't stretch anymore, and then you move a little further, you know, laterally.
So where do you start?
Ideally, start with like deep breathing,
Okay. That gets that
getting your
lymphatic
abdomen.
moving behind the
Mhm.
lungs. Yep.
It's one of the
Yep.
best things you can do for your lymph system is breathe deep, and then open up right above the clavicle, collarbone.
And is that with the stretching motion with your fingers?
No,
So if you're
that's just
watching on video, show us what this looks like.
that's just little tiny like circles. I don't know if you can see very good.
Yeah, I can see.
I'm pushing in like that.
Okay.
And you're gonna do the same thing under your arm, except your hand's gonna go up here and you'll just kind of like roll inward.
At the upper part of the armpit. So arm over
Mhm,
your head, two fingers up against the
mhm.
superior part of the armpit and
Yep,
just rub in a circle. Yep.
yep. Kind of towards it. You're like
To open
waking.
it. Come towards the arm, toward up,
Yes.
up and around, up and around, up and
Mhm.
around. Okay. And
Yes.
then
I also have a little tutorial that I have put together, so I can send that to you too when we're
great.
done. You
I'll link
can
that in the show notes. That'd be
get
great. Thank you.
mhm. Yep.
So the breast massage, how long does this whole process take?
Probably
10,
5 minutes.
5 minutes.
Not
So
terribly
you
long.
recommend to start breast massage every day. This is for every woman,
Yep.
no matter.
No matter. I
Okay.
said breast massage every day, deep breathing every day, which you should be doing when you're doing your breast massage. Dry brushing is always really good, but if you're doing breast massage, it's not as necessary.
Hmm.
I recommend that women take something to support their liver because that's essentially where all that estrogen needs to filter out through. So if you're
Right.
moving it out of your breasts, your liver needs to be able to handle it.
Right.
So supporting your liver and then that supplement from food research,
Oh,
Simply
yeah.
Min.
The Simply Mammary. Yep. Simply
Mhm. I have
Mammary is
a
good.
lot of women who like that and take it.
Mhm.
Those are the big ones that I do.
Okay. So we want to give like support to the tissue itself and
Mm.
then get the lymphatic moving out of the breast tissue. And then what do you think about underwire bras?
Ooh,
Ugh.
it's a hard pass.
Hard
Yeah.
pass. So
Yep.
there's a book. I'll find it. I'll link it in the show notes, but it's a great book. It talks exactly about what happens when women wear
Mm.
bras with underwire and how that compresses
So
the
bad.
lymphatic fluid drainage. And it basically just allows all those toxins to just stay in the breast tissue.
Correct. Yep.
Yeah.
Yeah, if you're not moving it, it's not moving, and then on top of that, you're blocking it from moving if you want it to because you're
Right.
wearing a wire.
Right. Right. Right.
Yeah.
So the option for women would be then to choose a bra that's something that's got a little bit of support. How do you feel about going braless? Good, bad?
I mean, I think it's great. I just don't think a lot of women are comfortable with it. I'm not even comfortable with it. I'm just wearing like my everyday bra is a tank top with a built-in shelf, and my boobs. I've had 5 children and nursed them all. My boobs are long and
Yeah.
saggy.
Yeah.
But so I'm not going braless, but and the bras that I'm wearing or what I'm wearing isn't super supportive, but I refuse to do an underwire or anything really that's super constricting because it's doing the
A
same thing.
around, yeah. So even bras, have that like built in underneath the breast tissue,
Or
but it's tight. Like you're looping it in the back. You're
mhm,
still compressing the area underneath the
yeah.
bra. So almost like a sports bra type, but a looser sports bra. Some of my favorites, I don't know, Ashley, if you've used these, but some of my favorites are from Soma
Mhm.
because they're soft. They're not tight. They're very stretchy, but when they're against the body, they're not so tight that it presses against the rib cage enough that it's going to really significantly impair. Like you could easily get two fingers up underneath it,
underneath.
it'll move and give,
Yeah.
but it still gives good support. There's some padding in there. It still gives good support. But, to your point, a woman has in breast surgery, she's augmented the breast tissue and
Mhm.
then, she may not be needing to wear a bra, but then that because she's had surgery
That's
to
going to.
augment the shape, but
Yeah.
she's also messed then with the drainage
Oh, yeah.
of
Any
the
kind of surgery, tattoos, even, because lymph nodes or lymph vessels are superficial. So they're just under the skin, and anything like that is going to damage them. And a lot of women that I see end up, because I'm a lymphedema therapist as well. So a lot of women that I see post-op or even after a tattoo, they got a tattoo and they went out and accidentally got a sunburn. And now they have lymphedema in the leg. They got the tattoo on their foot and it's
Wow.
destroyed their leg. So
Wow.
I mean, that has nothing to do with breasts, but
Yeah, but it
mammograms and
speaks yeah,
thermography, but it speaks to the importance of having a healthy lymphatic system.
right, right. There's a resource that you shared with me, and it's from a document or a book. It's chapter 25 of a book called the Biomedical Engineering Handbook. And when you gave it to me, I thought, I am not interested in biomedical engineering. However, this whole section talks about thermography. And so I want to read a few of the key points from, they're kind of like the cliff notes from this chapter. So the high points was in 1982, the FDA approved thermography as an adjunctive breast cancer screening procedure, and it's been heavily researched since the 1950s. Now, remember that what is written here is based on the studies, the facts in this article. It's very well referenced. But remember that what you're hearing as far as thermography not being a viable option is from who? The
The people
medical.
who fund the mammogram.
Exactly. So we have to remember that, the bad mammogram, it's not trusted. That's from the people who need to make the money from the mammogram. So
Mhm.
breast thermography has had extensive research since the 50s, over 30 years of research that have 800 peer-reviewed studies on breast thermography currently exist. And that was as of 2006, by the way. So it's more now. In the database, over
Mhm.
300,000 women have been included as study participants. The population in the studies were large, well over 10,000 participants. Some of the studies followed patients for up to 12 years, and the protocols have been established for over 15 years. And again, this publication was in 2006. So that was, almost 20 years ago. Breast thermography has an average sensitivity and specificity of 90%. And this one really got me, an abnormal thermogram. Okay, abnormal, like TH3,
3
an
through 5.
abnormal thermogram is 10 times more significant as a future risk indicator for breast cancer than first order family history of the disease. But
Mhm.
yet, that's what the women are often told. Do you
Mhm.
have a history
No.
of breast cancer in your family? And Ashley, you shared a statistic with me. And what was that had to do with that familial risk?
It's 6 to 8% of all women who are diagnosed with breast cancer have a family history of breast cancer. So it's such a
Super
minuscule
small. Yeah.
amount compared to the number one risk factor is thick, dense breast tissue and estrogen dominance. So
Yeah.
we don't talk about that because
Right.
mammograms
Nobody
and
ever
ultrasounds can't see through it.
Yeah, exactly. This says a persistent abnormal thermogram carries with it a 22 times higher risk of future breast cancer.
Mhm.
So that leads me to think that the TH3 grading that you're talking about, that we really need to work with women to aggressively
Mm.
get them into that TH2.
Yep.
Because
Agreed.
if it's considered borderline abnormal,
Mhm.
then if this has a 22 high a thermography, an abnormal result is 22 times higher risk of future breast cancer, then it would behoove us to say, have you had a thermogram? If so, what is your score? And then you'll know clinically what to start including with them, whether it's this daily massage, breast massage,
Mhm.
or, adding in phytoestrogens that can help move out those toxic estrogens, getting the liver to move, et cetera. This says an abnormal infrared thermography image is the single most important marker of high risk for developing breast cancer. And they've shown that breast thermography has the ability to detect the first signs that a cancer may be forming up to 10 years before another procedure can detect it. Now, that's
Crazy.
understanding that there's that 10% margin of error you
Mhm.
said.
Yeah.
Yeah. Breast thermography significantly augments the long term survival rates of its recipients by as much as 61%.
Mhm.
And when used with other approaches like the 3D ultrasound, 95% of early stage cancers will be detected. So,
That's
why we're not recommending and really talking about thermography with our patients is
Mhm.
for every female patient, I believe that this can potentially save their life conversation that we
Mhm.
need to be having with every single woman. And Ashley, to your point, the women that you see are the ones that are there because they're interested in the alternative
Mhm.
option. But you
A lot
also
of them are
probably
like,
get,
"No way will I ever get a mammogram."
yeah, but then you probably get other women that come in that have no clue.
Mhm.
And
I
that's
had
an
a woman
opportunity.
in my office yesterday who came in to get a thermogram, and she actually wanted to do breast, neck, and face because she had some dental work associated with the sickness.
Oh, interesting.
She was diagnosed with breast cancer in April this year, had a lumpectomy, declined chemo and radiation because they wanted to do both, even though they were confident they got all of it and it wasn't in her lymph nodes. She had 4 lymph nodes removed. And so
Yeah.
she came in and she was one of the ones that was like, when they found my cancer, they literally said, "Here's a folder. Here's what you're going to do. We have all of this lined up for you. We know who you're going to see. We know what kind of medication you're going to have."
Wow.
And she said, someone who questions everything, she's like, it didn't set right with me, but I could
Yeah.
100% see how someone who has no idea, they've just been getting mammograms. They're like, oh, this doctor saved my life with this folder with all of this stuff in it that I didn't have to think
Wow.
about anything that I had to do. They've got it all laid out for me. And that's, I think, why sometimes it's appealing for the general public, feels safe for them to be getting mammograms because they trust their doctor that their doctor's just going to have it all figured out and
Right.
here plan, and I don't have to make any decisions about my health.
And you mentioned too that the other thing that kind of flagged for me, and then we'll wrap with this, and that is that you said she wanted her face, her throat, and her
Mhm.
face because she had dental work done.
Yeah.
I recently watched a documentary, and I think, did you watch it?
Mhm.
Yeah.
Yeah.
And what was the number in there? It was like
98 or
90.
6%. I've
Go
started
ahead.
asking every patient, have you ever had a root canal? And there's 2 teeth on the top on both sides. And usually the answer is yes.
Yes. 98% of women that have breast cancer have had a root canal in those two teeth, one of those
On
two
this
teeth on the
on the
same
same side.
side.
Mhm.
So you did the thermogram for her dental work
Yep.
and did anything show?
Yeah, she had inflammation on the face, same side.
Same side. See, there you go. So
Mhm.
when you refer out for a thermogram and it's a for breast for a woman,
Mhm.
ask them to do it for the mouth as well to
Mhm.
see if you can detect it. So you can't always, you ask the patient, do you have any issues going on in your mouth? No, fine. I'm good. Brush every day. I'm fine. Oh, that there's no infection
Yeah,
in there. Like we don't know
we don't
because it
know.
could be in the bone, it could be deep in the tooth. It could be that, lingering infection from a root canal that's just still
Mhm.
all harboring up in there. But that statistic really turned me on my ear a little bit
Yeah.
for every woman that's had breast cancer. And it might be interesting just to even go back and start, thinking back through your existing patients that you know of that had breast cancer. How many of them had a root
Have
canal? I
issues.
would be fascinated to know.
Mhm. Well, and as I'm talking to more people about that documentary, they're like, "Oh, I have Crohn's disease and I have 8 root canals and, oh,
Yeah.
look, they're all connected to the certain."
To
It's
this
just crazy to me how connected the
exactly.
body is.
Exactly. I will get that documentary and I will also link that in the show notes for you as well. So, Ashley, thank you so much for coming on. I
Well,
knew that you would be able to shed way more light on this since this is your jam, not mine. So, I really, of course, love you to death since
thank
she's my
you.
number two, but self proclaimed number one child. Yes, she says. But thank you so much. I think this is helpful for everyone listening. So, thanks so much for joining me on the podcast.
Yes, thank you for having me.
And how can people learn more about the work that you do? Where can they find you?
Oh, my website, arukawell.com. It's ARUKAH well.com.
Okay.
Mhm.
And are you on
All
social?
We are on social at Aruka Well for both Facebook and Instagram.
Nice. All right. We will
Yeah.
link that in the show notes as well. And
Thank you.
by the way, as a mom, she does great on her social media, just so you know.
Thank you.
Like she does a really good job. So I want to be like you when I grow up. She does a really good job on her social media. So you should check her out. We'll put all the links in the show notes. the documentary, Ashley's also provided some images, and I will link those pretty color images as well as, did you send black and whites as well?
Yep.
Okay. So we'll link those in the show notes as well. So be sure, whether you're watching or listening, that you go to the show notes for this particular episode where we're talking about mammography and why thermography is a much better option. All right. Thank you, Ashley. Appreciate
Thank
you.
you.
Thanks. Bye bye. Well, that was quite informational, was it not? So there was so many things that I promised you and she promised you. So I'm going to have to go back and listen to that episode again to make sure that I get all of those resources, especially that book. I couldn't remember the title, but I'll find it. I will get it to you and they will all be linked up in the show notes. So if you are driving, you're, mussing around, you're listening to this podcast while you're out doing something else, I will give you the podcast number. So if you go to rondanelson.com/180, /180. Just remember 180. That's the only number you have to remember. If you just type that into your browser, it will take you right to the show notes page where you can find all of these resources. And if you love this kind of information and you'd like more of this kind of information, or to learn about how to apply clinical things in your practice in a very simplified, easy, and very excellent way, I invite you to join me inside Clinical Academy. It's my monthly membership that is just for wellness practitioners who love using food-based or whole food-based or, quality herbal and nutritional supplements that are not full of the synthetics that the supplement industry loves to use. So that's my jam. Those are my people. And if that is you and you're looking for a clinical mentor, that would be me. I'm happy to help you. All you have to do is go to rondanelson.com/clinical academy. I would love to have you. Let me tell you, there's no strings, no nothing. You can sign up, join, you can stay forever, which most of my doctors do, or you can jump out if it's not your cup of tea. But I'd love for you to check it out. See if it meets your needs. There's a lot of clinical training in there, lots of resources, and most importantly, a ton of protocols. That's cool. We always are looking for those protocols. So all you have to do is go to rondanelson.com/clinical academy. Thanks, friend. I'll see you back next week on another episode of The Clinical Entrepreneur.